name's Nicole Coffman. I'm here with Bellarmine News 1. John will be talking to you about the weather in just a few moments. But first, breaking news, Ms. Tyo Amos is at the scene at Bellarmine Hospital. Let's check.
Reporting live here from Bellarmine Hospital, where we have Jenny, a patient who has a horrible mistake and had her wrong leg amputated. We're going to go check in with the patient now.
So Jenny, tell me what happened.
Well, I have the diabetes, and the doctor was supposed to cut off my bad leg, but he cut off my good leg. Look at my good leg, it's gone. And look at my bad leg. You think he cut off the black leg?
Accidents like this happen all the time. We're going to go back to our studio where we have Jenny's nurse Jackie and Dr. Oz, our special guest, to talk about this instance.
Thanks, Miss Amos. As you can see, she's back in the studio with us now. And we have special guests, Dr. Oz and Nurse Jackie.
Well, so Dr. Oz, tell us, how does something like this happen? Well, Dr. Oz, if you would have listened to me when I called our timeout, this poor lady wouldn't have lost her leg. I mean, geez, that's what we're supposed to do, right?
I have a million surgeries a day. I don't have time for that. Too often, patients are affected by having the wrong surgery, and we have done our research to see what is being implemented to protect patients from having the wrong surgery.
According to Joanna Briggs, a systematic review was conducted to report the incidence and causes of wrong site surgery and to determine what preoperative measures are effective in preventing wrong site surgeries.
A Joanna Briggs systematic review reported that causes of wrong site surgery include incorrect patient positioning or preparation of the operative site, patient or family providing incorrect information, incorrect or lack of patient consent, failure to use site markings or surgeon fatigue, multiple surgeons, multiple procedures on the same patient, unusual time pressures, emergent operations, breakdown in communication between surgical team members and patient or family members, and unusual patient anatomy. The authors recommend that each institution create pre-op checklists and procedures to prevent such errors. The National Guideline Clearinghouse has created several guidelines to help all staff participate in and to prevent errors such as this.
A Cochrane systematic review was conducted, and they stated that educational intervention, including examination of previous incidences, help to reduce the case of incorrect procedures.
As Nurse Jackie mentioned, a timeout was called, and the guidelines state that an active verbal timeout to be called after the surgeon is scrubbed and gowned, but just prior to beginning the procedure. This is the final safety check before a procedure, and this can be the difference between amputating the wrong leg and then having the correct leg, as just as in Jenny's situation.
The Joint Commission National Patient Safety Goals require that timeouts are consistent with the guidelines. To protect patients from having the wrong surgery procedure, institutions must develop a culture of safety and follow the simple yet crucial evidence-based guidelines to prevent wrong surgeries.
All three sites recommended that surgical site marking is used, and it has been shown to be a great tool to make sure that patients and staff know what and where the surgery is to be performed before the patient enters the operating room. Anatomical diagrams are used if the site is not possible to mark. Additionally, the National Guideline Clearinghouse stated that proper patient identification and consent prior to procedures are key steps to ensure patient safety and prevention of wrong surgical procedures.
Thank you all for joining us for this important broadcast today.
And stay tuned as we follow up on our patient journey.
Good night from Bellarmine News 1.